Hi there, my name is Dr.TwoMoon, and as many of you know, I'm a naturopathic medical doctor and an acupuncturist. And today I wanted to give you a quick introduction to acupuncture. I think there's a lot of misinformation about acupuncture out there, and sadly most physicians don't really understand acupuncture, so they rarely recommend it to their patients. And furthermore, there's a lot of public opinion that acupuncture is either not based on a very scientific principle and or that it hurts or it's only useful for a few conditions. And these are all myths that I think need to be destroyed because acupuncture is actually one of the most valuable healing techniques available to us. So the quick version is acupuncture is a few thousand years old. It is not new medicine, and in those thousands of years a lot of its tenets have remained the same, and that's because they're very well informed and they work extremely well. There are 12 primary meridians on the body. Meridians are like stream beds, and along those stream beds are specific points of interaction that can stimulate effects in the organs, in your nervous system, in your endocrine system, in your digestive system. So we can balance hormones, we can improve digestive function, we can help you sleep better, we can improve anxiety and depression, all through using these very precise points. The points have very specific locations. It's not at all random. There are 365 primary points on those 12 meridians, and each of them has very precise functions. And those functions are informed by what we find in a person's pulse. We feel the pulse to determine how the organs are functioning and how the qi is moving through the body. We also look at the tongue, and the tongue is a wonderful map of the entire body. And we combine that information with how the eyes look, how your nails look, how your face looks, and what you tell us about how you're feeling. So in that way, once acupuncture points are picked as part of a treatment process, they're picked according to precise identified symptoms and indications that are very scientific in their process. This is not necessarily how everyone practices acupuncture. That's one of the biggest failings I think that has happened, is that in the Western world, a lot of people have started to practice an acupuncture that's not based off of those tenets at all. It's sort of a one-size-fits-all approach in which someone says, I have depression, and the same points are used every time, and that individualized attention is not given. That's a big, big flaw, and in fact, that's not good or proper use of acupuncture. Western medicine has done a lot to derail acupuncture in that regard because they teach weekend seminars to physicians and nurses to allow them to do acupuncture, but in those weekend seminars they're just doing a one-size-fits-all approach. So if someone has pain here, use these points. If they have pain here, use these points. And there's no philosophy behind it. And very often I've seen people in my practice who've had acupuncture elsewhere, but it was done without any sound philosophical basis, and the patient often reports that they didn't get much benefit. They didn't have a big experience. So that's one thing to remember. Acupuncture does not hurt, or at least it shouldn't hurt in a dramatic way. Occasionally when the needles go in, there's a brief sort of prick sensation. And then you can also have an aching at the point. That's not unusual. Remember, we're activating very precise energetic locations on the body. And those energetic locations stimulate deep function. So as the qi moves and arrives at that point, on occasion you do have a sensation of that qi arrival, and that's okay. The point is that once the points are in place and the practitioner has stopped touching them, there shouldn't be any discomfort. You should actually start to feel very relaxed. You may start to notice movement sort of on the inside of the body. These can be tingling sensations, they can be flushes of warmth, they can be feelings of movement even though you're lying perfectly still. Once the needles are in place, they have to stay there for about 40 minutes or more in most cases. And the reason for that is that we're reprogramming the body. We're providing information on how to get back to a balanced point. And to do that, we need the information to stay there for a while. Even after those needles come out, those points are active for about 7 hours. So a treatment isn't ended once the needles are taken out. It's just that the needles being inserted allows the information to go deeper. There are very specific rules to when we use certain points, how we use them, how we stimulate them with hand stimulation in my practice. I do not use much electrical stimulation, and that's just because I come from a school of classical Chinese medicine in which hand technique is stressed much more than electrical stimulation, which came much later. It is not a classical tool. It is one of those Western applications to Chinese medicine that, although it may have some usefulness, it doesn't go with the classical reasons why points are picked and the classical reasons why and how they're stimulated. Acupuncture should be very relaxing ultimately. No matter what you're treating, people generally feel very calm, very peaceful. Some people fall asleep. Other people enter sort of a meditative state. It is one of the best times to do meditation. I have a lot of patients who specifically use that time to focus on their breath and do their meditative practice, and they find that they can even go deeper sometimes with acupuncture than they were able to go when they're not in an acupuncture state. The needles are all, of course, first-time use. A lot of people still ask that question, but of course we don't reuse needles at all in any practices I know of. They're very thin. They're so thin we could bend them with our fingers. So it's not like having a blood draw done where that is a much larger needle, and it's also hollow. Acupuncture needles are solid. So they're sliding into these precise locations that were indeed meant for that kind of stimulation. After the needles are removed, usually you just take your time and you get up, and there's no, significant alteration. People don't need to have a driver to come get acupuncture. You're going to be able to think clearly and move easily afterwards. It's not like other medical procedures. And the fact is, like I said, the treatment effects unfold over the next 7 hours and even over the next few days. So sometimes people have an experience of symptom relief right away. Sometimes when we're treating more chronic problems like anxiety, depression, insomnia, digestive disorders, it takes a while for those relief patterns to emerge. If we're treating acute pain like a sprained ankle, that might be better within hours after a treatment, and I've seen that multiple times. So it's important to remember that acupuncture isn't just for 1 or 2 conditions. Pain is not its only use. In fact, it's a really limited use of acupuncture. Where it excels is actually on patterns that are much deeper. The premise being that our body is a constantly flowing, energetic being with particular electrical currents that keep our cells informed. And when that information gets interrupted, what happens is that we have symptoms of diseases, symptoms of issues, and acupuncture is a way to reconnect that. Acupuncture is often combined with other therapies, but over my 10 years in practice, I've certainly treated a lot of people who used only acupuncture and had wonderful results. This is my brief introduction to acupuncture. Look for further videos on other aspects of Chinese medicine and how they can be combined with other therapies, both natural and conventional, that you're doing to enhance your health process and improve how you feel.